you know, it's not a joint, but we can move the scapula. We need the scapula to be able to protract, retract, upwardly rotate, downwardly rotate, or you can say elevation, depression, if we're going to do the techniques together. Since we are doing joint mode techniques, we're going to try to do components. We're going to do rotations and slides as much as possible and keep them as linear as possible or just rotational as possible for this one. All right, so unlike the other joints, we are going to do rotational movements for the scapula, given its importance. So I'm going to have the patient lie on their side. They're going to be facing the therapist. Sometimes I'll do knees bent with a pillow in between if they're uncomfortable in their side position. The other thing that you can use if they're uncomfortable, and again, you'll know your patient's level of comfort with you being close and in tight when you first introduce yourself and you start working with them. This is just a barrier you can put here. Okay, I find it to be in the way, so if you do without, it's going to be easier for you because you're worried about the pillow falling and being in the way. Okay. For this one, I'm going to have her scoot to the edge, and when I say scoot to the edge, I'm going to put my thigh here so she doesn't feel like there's just keep going, and roll off. Okay? I don't want to bend way over here to do this thing. Okay, this is going to hurt my back, so I want to be right in here. So the face is right here. I'm going to take one hand; it's going to be underneath. This arm is going to drape. The reason I do underneath is so that I can get her to relax her shoulder, because I'm going to try to move this big bone back here, and if she's holding it tight, I'll never get to do anything. Once I have that, I'm going to use my chest. I'm going to get in here nice and deep. Okay? So I'm in here. I can get to the scapula. I can palpate the border. There's the medial border. Inferior angles right there. Lateral border. Superior angles right there. So I can really grab this thing and get a hold of it. Okay? One of the reasons I chose her is because not as much, no offense, there's not as much muscle bulk here, and it's easy to see that scapula and grab a hold of it. You can still palpate all those things on some of the thicker guys. All right? It's not going to show up as well when you do it. You're going to feel it. You're just not going to see it as well. All right. So you're just going to, and this gets them in a relaxed posture to get those muscles to relax. So the first thing we're going to assess, I'm going to pick the two hardest ones first. We're going to do retraction and protraction. And so what I'm going to do with retraction, you'll notice I've taken my thumb and I've got it to the front. Sometimes I'll just use my chest to guide it. It depends on comfort level of the patient. What I'm going to do with this is I'm going to retract it right there. Okay, and I'm going to push it. I'm going to feel it. Now, unlike the other joints, this is going to be a soft tissue stretch because there's no joint capsule here. So I'm taking the muscles and I'm stretching them that way. So I just want to assess the glide all the way in, right there, and I'm going to push on it right there and feel that nice soft tissue stretch there. Then from here, I'm going to come back to neutral, and then I'm going to pull all the way out, and I'm lifting up. You see, I'm lifting that out, and I'm stretching the rhomboids here, and I can feel the stretch. You'll notice that I've had to sort of back away to let this come over. They're going to want to roll. Be careful not to roll them right off the table. Okay? So when I'm doing this, I try to come up more than roll forward. So I'm trying to lift straight up with this. I'm trying to lift straight up, keeping my body here so she doesn't feel like she's going to come off the table. So that's going to be a retraction, protraction, mostly a medial slide and a lateral slide. There is a little rotation here. You can't help it because you're using the thoracic cage as your guide. Next one we're going to do is upward and downward slide. For downward slide, this hand is going to do most of the work, and this hand is guiding. Come right here and press straight down. Inferior glide. You're going to feel lots of tension in the upper trap for this one. Okay? You can kind of see that when I get there. So there's the end position there. Superior glide. This hand is now doing the work. This hand becomes the guide hand. Working hand, guiding hand. Come straight up, right there. These motions of slide, upward and downward slide, or superior and inferior slide, will have slight rotations with them. But we're going to focus on the slide component. Okay?
That superior slide is her, like inferior angle kind of in your web space?
Yeah, I don't put it here, but I kind of cup it right there. Okay? Because I don't know, I tend to use my second finger more than my first finger. I don't know why, it's just the way just if you want to get in here, you can. I get that hold right there. Okay? So I'm pushing right there up. Right there is down. Feeling it. The last two are rotations. We're going to do downward rotation first. What I'm going to do is this finger on the medial border, superior half, I'm going to be lifting like this. So the motion is going to be, I'm going to be attempting to do that motion. This thumb is going to be pressing down like that to make it, so I'm going to make a wheel, as if I'm turning a wheel like that. Just going to look, I'm going to get in here again and get it relaxed. And I'm lifting and pushing at the same time. Rotation. Downward rotation. To do upward rotation, exactly opposite. Now I'm going to use my thenar eminence on this side to push that way and lift with my fingers here. And there's the upward rotation. upward rotation. Again, I'm not worried about elevation, just the upward rotation component. Downward rotation, upward rotation. Okay? Yes?
So does she have